Hello, thank you for taking the time to watch this video. My name is Mari Walsh. I'm a Cigna engagement consultant. Today I'm going to talk through the Middlebury Cigna benefits, specifically the medical plan options, the pharmacy benefits, and the programs, resources, and tools that you have access to as part of being a Cigna member. I want to mention that our top priority at Cigna is the health of you and the health of your family. We provide 24/7, 365 access to our customer support team, and you can connect with us at any time, day or night, by calling the number on the back of your Cigna ID card. Let's start by walking through your Middlebury medical plan options. The two plans that are being offered for the 2021 plan year are the PPO plan, which some folks may be familiar with as the legacy plan, and then the Panther plan, which is a high deductible health plan with a health savings account. These are the same two plan options that are being offered during the 2020 plan year. So if you are familiar with the Middlebury benefits, you may already be familiar with one or both of these plans. All of the figures that you see on the slide are specific to in-network care. We like to remind folks that it's in your best interest to stay inside the Cigna network whenever possible. The reason being that we have contracted rates in place with our in-network providers and care facilities that ensures you're going to pay the best price for the care that you receive. You do have the choice to go outside of the Cigna network, but in those cases, we do not have contracted rates in place, and so there's really no limit on how much you can be billed for your care. Starting with the first row in white, your calendar year deductible. Your deductible is the set amount of money that you're responsible for paying before you start sharing costs with your plan. You can see that the deductible that you're responsible for paying depends on which plan you select and which type of coverage you have. So for the PPO plan, it's broken out into individual, which would be just yourself, individual plus one, which would be yourself plus one additional person on your plan, and then family, which would be 3 or more people on your plan. There is an embedded individual deductible on the PPO plan. So as an example, if you had family coverage and one person in your family met the individual level deductible on their own, that person's claims moving forward would be subject to the coinsurance. Alternatively, the family collectively can meet that family level deductible, and then all family members' claims are subject to the coinsurance from that point. On the Panther plan, you can see that the deductible depends on if you have individual or family coverage. Individual would be just yourself, and family coverage would be 2 or more people on your plan. And for the Panther plan, there is not an embedded individual deductible. So the family collectively needs to meet that $4,000 deductible before anyone's claims will be subject to the coinsurance. So the coinsurance is the phase of your plan that kicks in after you've satisfied your deductible. And this is when you share expenses with the plan. So you can see on both of your plan options, you are responsible for paying 20% of covered expenses after you meet your deductible. For both of the plans, in-network preventive care is covered at 100% no matter which phase of your plan you're in. So even if you haven't met your deductible, things like your annual physical and critical cancer screenings will be covered by the plan. And there are a few services on the PPO plan that do not have the deductible apply. That includes your primary care office visits as well as your specialist visits. So in those cases, even if you haven't met your deductible on the PPO plan, you would just be responsible for paying 20% of the billed charges. The money that you put towards your deductible and your coinsurance accumulates towards reaching your out-of-pocket max. So think of this as the limit on the amount of money that you can spend out of pocket during the plan year. Once you reach your out-of-pocket max, the plan is going to start paying 100% for covered expenses. You can see how the out-of-pocket max breaks down depending upon which coverage you have and which plan you choose. And for the PPO plan, your medical out-of-pocket max is separate from your prescription out-of-pocket max. Alternatively, on the Panther plan, the prescription out-of-pocket max is combined with the medical out-of-pocket max. We're going to spend a few minutes talking through the Panther plan and how this type of plan works. So it combines your Cigna medical plan with a health savings account that can be used to pay for qualifying healthcare expenses. The IRS outlines which type of expenses can be paid for from a health savings account, and to see the full list, you can visit cigna.com/expenses. Your Middlebury health savings accounts are going to be managed by Health Equity, and they will be providing additional education and resources to help you get the most out of your health savings account. With a health savings account, you own the fund, so you're able to take the account with you if you change employers or retire, and both you and your employer are eligible to contribute into the fund. Middlebury has set some very generous contributions for the 2021 plan year. So if you have the Panther plan with individual coverage, Middlebury's contribution will be $1,000. And if you have the Panther plan with family coverage, that contribution goes up to $2,000. Taking a look at how it works when it comes to paying your healthcare expenses. So this example is specific to individual coverage on the Panther plan. So you have a $2,000 deductible. The Middlebury contribution into your HSA is going to be $1,000 over the course of the plan year, and then you're responsible for coming up with that additional $1,000 to meet the $2,000 deductible. Once you satisfy the deductible, you'll enter that coinsurance phase of your plan where you're sharing costs with the plan. You're responsible for paying 20% until you reach that $3,000 out-of-pocket max. At that point, the plan's going to start picking up 100% for covered expenses. And again, another reminder that no matter which phase of your plan you're in-network preventive care is covered by the plan at 100%. Switching this example to family coverage on the Panther plan, in this scenario, the deductible has gone up to $4,000 and the Middlebury contribution has increased to $2,000. So you are responsible for coming up with that additional $2,000 to reach the deductible. Once you satisfy the deductible, again, you'll be responsible for paying 20% until you reach that $6,000 out-of-pocket max, at which point the plan will start picking up 100% of covered expenses. Moving into your pharmacy benefits, Express Scripts is Cigna's new home delivery pharmacy effective January 1st of 2021, and there's some important changes to be aware of that are going to happen with this transition. You'll be receiving a new Cigna ID card in the mail, and this ID card will be good for both your pharmacy and your medical benefits. It's really important that starting on January 1st, you bring your new ID card with you, especially if you're heading to a retail pharmacy to pick up a prescription. The pharmacist is going to need the updated pharmacy information on your new card in order to process your order. Some additional updates to be aware of. You're going to start seeing Express Scripts on your pill bottles and order materials. You will still be able to manage your pharmacy benefits through mycigna.com and your pharmacy orders. And important to note that at the end of the year, there are going to be 2 days where you will not be able to order home delivery prescriptions online or by phone, and that's December 31st and January 1st. So if you're planning on placing a home delivery order by the end of this plan year, be sure to do that before December 31st. We've got some great tools available to you to help you get the most out of your pharmacy benefits. And one of these tools is the MyCigna mobile app. So imagine that you're sitting in your provider's office talking about a new medication that you may be going on. You can pull out the app, easily look up that medication, see if it's covered by your plan, what your costs are going to be, and also see if there's any lower cost alternatives available, allowing you to have a really informed discussion with your provider. Through the app, you can also easily find a pharmacy in the network, and you can ask a pharmacist a question 24/7. I mentioned that Express Scripts is Cigna's new home delivery pharmacy. Through this service, you can get fast, free shipping of your maintenance medications to your home or work address. Those maintenance medications are the drugs that you're taking on a regular basis, and you can fill up to a 90-day supply at one time, making it really easy for you to stay on top of taking those medications. If you're managing a complex medical condition, you'll have access to Accredo, Cigna's specialty pharmacy, which will connect you with specialty trained pharmacists and nurses who can provide counseling and training on how to properly administer your medications. With the Cigna 90 Now program, you can choose to fill your maintenance medications in either a 30-day or 90-day supply. For those 30-day supplies, you can use any retail pharmacy in your plan's network, and you'll have the option of switching to a 90-day supply at any time. You can find in-network retail pharmacies through mycigna.com, the MyCigna mobile app, or Cigna.com if you're new to the benefits. For those 3-month supplies, you can use an in-network retail pharmacy that's been approved to fill 90-day prescriptions or use Express Scripts home delivery. Taking a look at your prescription costs, so the amount that you're responsible for paying for your prescriptions will depend on which plan you select, so the PPO plan or the Panther plan, and also which tier your medication falls into. So on the left, you can see generic, preferred brand, and non-preferred brand. As you move up the tiers from generic to non-preferred brand, your costs are going to increase. I want to point out that on the Panther plan, the coinsurance that you're responsible for paying for your medications will only apply after you have satisfied your deductible. So if you head to the pharmacy on January 1st and you have not yet satisfied your calendar year deductible for the new plan year, you will be responsible for paying the full retail cost of that medication. A reminder that your medical out-of-pocket max is combined with your prescription out-of-pocket max on the Panther plan, and it is separate on the PPO plan. And on that PPO plan, you can see that with those 90-day supplies, there is a nice baked-in cost savings. So you're getting 3 times the medication, but only paying twice the cost. Now, you may be on one of the Middlebury plans today and considering switching to the other plan, or you may be new to the Middlebury benefits. So I just wanted to spend a few quick minutes providing an overview of the main plan differences between the PPO Legacy plan and the Panther plan. Now, I'm not going to go into all of the intricacies here, but feel free to pause the slide if you want to read over all of the details. So on the PPO Legacy plan, there are some benefit categories that have an unlimited number of visits, and that includes acupuncture benefits, short-term rehabilitation services, as well as home health care. Alternatively, on the Panther plan, these benefit categories have limitations in place. In addition, there are a few benefit categories that are covered on the PPO plan that are not covered on the Panther plan. And that includes massage therapy benefits when medically necessary, as well as hearing aid coverage. So again, those would be covered on the PPO plan and excluded from the Panther plan. Taking a look at your pharmacy costs, so the PPO plan runs on Cigna's standard drug list formulary. You have copays in place. You're allowed 1 retail fill on your specialty medications before you need to start using home delivery. And you have that separate out-of-pocket max for your pharmacy. On the Panther plan, you have the Cigna Value Drug List formulary. Your coinsurance does not apply until after you have met your deductible. You are not able to have a retail fill on your specialty medication. It must be acquired through home delivery. And again, you have that combined out-of-pocket max for pharmacy and medical expenses. Taking a look at medical management, there are less pre-certification requirements in place on the PPO Legacy plan and more pre-certification requirements in place on the Panther plan. Finally, taking a look at how costs contribute towards your deductible and your out-of-pocket max, we already talked about the embedded individual deductibles and how those are in place on the PPO plan and not in place on the Panther plan. And similarly for your out-of-pocket, it works the same way. So on that PPO Legacy plan, after each eligible family member meets his or her individual out-of-pocket max, the plan will start paying 100% of their covered expenses, or alternatively, the family can collectively meet the out-of-pocket max, and then the plan will pay 100% for all family members' covered expenses. On the Panther plan, it works differently. So all eligible family members contribute towards the family out-of-pocket max, and that needs to be satisfied before anyone's claims will be picked up by the plan at 100%. Taking a look at how your dollars accumulate towards reaching your in and out of network deductible and out of pocket. So we focused on in-network today because that's the best opportunity to save money. But in these cases, if you do go out of network, the PPO legacy plan has complete cross accumulation, which means the amount you pay for all covered expenses contributes towards both your in-network and your out-of-network, out-of-pocket max. If it is a service that also applies towards fulfilling your deductible, the amount you pay will contribute towards both your in-network and out-of-network deductible. Again, this works differently on the Panther plan, so it has one-way standard accumulation, so only the amount you pay for in-network covered expenses is going to count towards your in-network deductible and your out-of-pocket max. The amount you pay for out-of-network covered expenses is going to count towards both your in-network and out-of-network deductibles and out-of-pocket max. Taking a look at how the claims process works, so let's say that you're not feeling well and you head to your in-network doctor for a sick visit. At the time of your visit, you're going to present your Cigna ID card, and your provider's office is going to use the ID card to send a claim to Cigna, which includes some codes to show the services that you received during your visit. Cigna will use those codes to understand how to provide coverage for your visit. Now, because this is a sick visit, if you are on the PPO legacy plan, this is one of the service types that does not have the deductible apply. So in this case, you would be responsible for paying 20% of the billed charges. On the Panther plan, the deductible would apply. So you would need to meet your deductible if you had not done so already, which would mean you'd pay the full cost for the visit. And if you had met your deductible, then you would be responsible for paying 20% of the billed charges. In either of those cases, you can choose to use your HSA dollars to cover the payment. Following your visit with your provider, Cigna is going to send you an explanation of benefits, which serves as your receipt and will clearly detail the total billed charges, what Cigna is covering, and if there are any additional expenses that you're responsible for paying. If you are responsible for paying that money, it is due back to the provider's office. It is not due to Cigna. Moving into some of the program services and tools that you have access to as part of being a Cigna member, we've partnered with MD Live to offer you 24/7, 365 access to medical virtual care. Through this service, you can connect with board-certified doctors and pediatricians from the privacy and convenience of your own home. Medical virtual care can be a great cost-effective option, often much cheaper than going to ER or urgent care. We also offer virtual behavioral health appointments, either through MD Live or through our behavioral health network. And to schedule an appointment, you can visit mycigna.com or the MyCigna mobile app. Here, providing a list of some different minor medical conditions that are appropriate to be treated through medical virtual care. So the next time you have a cold or a flu, or you wake up with a fever or pink eye, keeping in mind that you can get treated right from your own home, and your virtual provider can even prescribe a medication that can be picked up in your local in-network pharmacy if that's appropriate for the condition that you're presenting. Taking a look here at the different behavioral and mental health conditions that can also be treated through virtual behavioral care. And this connects you with licensed counselors and psychiatrists who can diagnose and treat these conditions as well as prescribe most medications for non-emergency behavioral health conditions. Taking a look at the coaching resources that are available to you, at Cigna, we recognize the importance of supporting whole person health, body and mind, and providing holistic support no matter what you have going on in your life. So you can call the number on the back of your Cigna ID card to connect with a telephonic health coach. And if you're interested in managing your weight, quitting smoking, reducing your stress, or partnering with a clinical resource to better manage a chronic condition, all of those resources are available to you by easily calling that number on the back of your ID card. And these are offered at no additional cost to you, and you can engage at any point during the plan year. Exciting announcement for 2021, Middlebury is adding the OMADA for Cigna program. This is a digital lifestyle change program designed to help you lose weight, gain energy, and ultimately reduce your risk of developing some costly chronic conditions. We've seen great success with this program and a lot of positive feedback from participants. So I encourage you, when you see the communications for Omada, if you think you could benefit from a program like this, to try enrolling. And again, this is a resource that Middlebury has invested in order to offer the services to you at no additional cost. I've mentioned myCigna.com and the MyCigna mobile app several times already throughout this presentation, but I really want to drive home the value of these tools. We've made a huge investment in our digital technology, so when you log into myCigna.com or access your MyCigna mobile app, everything you see is going to be completely personalized to you, your family, the plan that you've selected, and where you stand within that plan. We have some fantastic cost transparency tools that make it easy for you to find high quality in-network care, and you can even view estimated costs that, again, are going to be based on where you are within your plan. So if you are a member today and you have not yet created your MyCigna account or downloaded the mobile app, I definitely recommend doing so. It's worth the time. And if you're new to the Cigna benefits, when you receive your Cigna ID card, you'll be able to visit mycigna.com to register your account. Another exciting announcement for 2021, Middlebury is adding Cigna's One Guide service. This is our highest level of customer support. You can think of this as a concierge team for your healthcare journey. And this team is available to you 24/7, 365 to help you better understand your plan, get the best care possible, and save whenever there's an opportunity. To connect with a One Guide concierge, it's really easy. You can call the number on the back of your Cigna ID card starting on January 1st, or you can use the click to chat feature at mycigna.com or in the MyCigna mobile app. And finally, a few quick notes about enrollment as we wrap up. So I recommend reviewing your summary of benefits for additional plan details, and also checking the online provider directory on mycigna.com if you're a member today, or cigna.com if you're new to the benefits, to see if your doctor participates in our network. If you're considering the legacy plan, you're going to want to view our PPO network. And if you're considering the Panther plan, you're going to want to view our Open Access Plus network. You can also go to mycigna.com or cigna.com to see if your plan covers your medication and at which tier. And the PPO plan uses the standard 3-tier drug list formulary, while the Panther plan uses the value drug list formulary. I want to thank you for your time and attention and making an investment in learning more about your Middlebury benefits. I hope you have a wonderful day.